This module has been created by Nipissing University's Best Practice Spotlight Organization team. It is based on the Registered Nurses Association of Ontario's Best Practice Guideline, Person and Family-Centered Care. The Nipissing University BSCN program is undergoing a pre-designation to become a Best Practice Spotlight organization. This project is funded by the RNAO in conjunction with the Ministry of Health and Long-Term Care. Disclosure. This presentation is based on the RNAO Best Practice Guideline, Person and Family-Centered Care. This graphic demonstrates how to use best practice guidelines based on your academic year. First year, knowledge of the best practice guideline and assessment using the best practice guidelines. This is also an introduction to best practice guideline order sets. In second year, clinical exposure to application of best practice guidelines. Third year is knowledge and use of best practice guidelines in complex settings. And fourth and fifth year is the application of best practice guidelines in complex scenarios, utilizing more critical thinking. This guideline outlines evidence-based practice that addresses recommendations for healthcare providers on the approach to client and family-centered care. An overview of supports and appropriate structures are discussed in order to provide the best possible evidence-based care. What is person and family-centered care? Person and family-centered care is an approach that means the individual and their family work together with the healthcare team to make the best decisions regarding the individual's healthcare. These decisions stem from the information received from these providers regarding treatment choices. The purpose of this model of care is to give the individual control of their health. When organizations follow this approach to care, the individual will be asked to assist with their plan of care so that care is delivered to meet their needs. This places the client in the best position to explain to the healthcare team what they prefer. This is an educational video discussing the Person and Family-Centered Care Best Practice Guideline. Common themes in patient and family-centered care. 1. Establishing a therapeutic relationship for true partnership, continuity of care, and shared decision-making. 2. Care is organized around and respectful of the person. 3. Knowing the whole person, holistic care. And 4. Communication, collaboration, and engagement. Healthcare reform. Various countries, including England, Australia, America, and Canada, are reforming their primary care supports to shift focus to the individual rather than the healthcare system and providers. The concept of this reform is to address the individual holistically as a whole person rather than to be known for their disease alone. Healthcare providers must sustain a partnership with the individual and their family and allow them to be an active member in their plan of care. This must be done while maintaining a standard of care that continues to be comprehensive, integrated, recognized, coordinated, and accessible. Person and family-centered care movement in Canada. Within the last decade, there have been various provincial initiatives, legislations, and organizations that have geared a focus towards the individual as a whole. These have improved the quality of care and have placed the person at the center of their healthcare, allowing them to gain a sense of control and to feel respected within the healthcare system. The next 3 slides outline 13 movements taking place in Canada to better person and family-centered care. Number 1. Local Health System Integration Act, 2006. This initiative was passed by the Ontario government. 14 local health integration networks, also known as LIN, were created to improve community engagement when it comes to the planning, coordination, and funding within each region and their individual needs as a community. 2. Primary Healthcare Charter, a collaborative approach. This was done by the British Columbia Ministry of Health, 2007. The purpose of this movement was to make primary healthcare within the province more client-centered by promoting both patients and families to focus on the integration of services, with key communication regarding all decisions within the healthcare system. 3. For patients' sake, Patient First Review Commissioner's Report to the Saskatchewan Minister of Health, 2009. This report is an in-depth review that touches on the patient's experience of care and the healthcare system. The research involved individuals, families, along with the community. It was made clear that putting individuals first is required and that the healthcare system must work to change focus to be person and family-centered. 4. Alberta Health Act Consultation Report, Putting People First. This initiative has developed recommendations for a new health legislation that is guided by placing individuals first and to improve the healthcare system. A mandated health charter was involved in the recommendations in order to acknowledge a partnership of health existing with the individual, the community, healthcare providers, and the government. Number 5. Excellent Care for All Act, 2010. This was developed in order to improve the experience that individuals have when interacting with the healthcare system, analyzing various quality improvement strategies that are directed at placing the individual in the center of their care. 6. Healthcare Transformation in Canada, the Canadian Medical Association, 2010. This is a document used to outline the CMA's action with a culture surrounding person-centered care, with a charter created specifically for this concept. 7. Patients for Patient Safety Canada, Canadian Patient Safety Institute, 2010. This platform is led by the patients through the Canadian Patient Safety Institute that supports the patient's voice, their experience, along with their perspectives to ensure the advancement in a person and family-centered focus. Number 8. Principles to Guide Healthcare Transformation in Canada, the CMA and the Canadian Nurses Association, 2011. The purpose of this guideline is to outline principles around Canada's healthcare system. Principles revolve around enhancing the healthcare experience, the improvement of population health, and improving value for money. Number 9. The Change Foundation's Journey into the World of Patient Experience, the Change Foundation, 2013. This foundation is central to improving individuals' experiences with care through change projects, including PATH and Panorama. The purpose of these projects are to promote the involvement of both person and family sharing experiences and their advice for system reform. Number 10. Rebuilding Healthcare Together, the Provincial Health Plan from 2013 to 2018. This was done by the Province of New Brunswick. This is a provincial plan that was created with community engagement, supporting the shift to person and family-centered care within the healthcare system. The establishment of partnerships created through the government, healthcare organizations, the healthcare providers, and the community of New Brunswick in order to strengthen and integrate services within or around the home to stay in the community. 11. The Canadian Hospital Experiences Survey. This was done by the Canadian Institute for Health Information in 2014. A survey was created by the Canadian Institute for Health Information to collect data regarding patients' perspectives when in an inpatient setting. This data was distributed to organizations throughout Canada and will be used to benchmark and to inform quality improvement to develop and enhance the delivery of care. 12. National Research Corporation Canada. The purpose of this corporation is to measure and improve both individual and caregivers' experiences with care and their overall impression of the healthcare system by implementing the 8 dimensions of care that matter most to patients. 13. The Registered Nurses Association of Ontario developed a model called Enhancing Community Care for Ontarians. Was formed with a focus on primary and community care with an intent to develop a cohesive healthcare system in response that addresses complex needs of people and the community, enables whole system coordination and care of services to assist with the sustainability of the healthcare system for those in Ontario. Healthcare Partnerships. It was stated by the authors of Partnerships in Healthcare Transforming Relational Process, 1998, that the most important competency to acquire by healthcare providers was the formation and sustainability of true partnerships. The creation of partnerships is now the central focus of the healthcare reform. By taking the time to build these relationships rather than to focus on treating the individual's disease alone, assist the individual to achieve the health goals that they may find difficult to attain on their own. These partnerships are based on qualities of support, the value of diversity, and the recognition and input from the individual, family, and healthcare provider. It is important to keep in mind that healthcare relationships should not be linear, but are dynamic and continuously evolving. They are affected by many factors, including internal and external, as well as the duration of the partnership. What is client-centered learning? Client-centered learning is a process used by healthcare providers that guides holistic, interactive, and social processes to assist client learning by planning learning sessions, document client learning, support individuals to become responsible in their healthcare decisions and choices, identify the patient's knowledge base and link areas they lack to a new learning opportunity. How can client-centered learning be facilitated? Collaboration with your client to assess their learning needs and any preferences they may have. When providing information, do so with health literacy in mind. Speak slow and clear, use plain language and simple illustrations. Create a non-judgmental and safe environment. 3 main concepts per learning session. It is recommended to do the teach-back method to assess individual learning. Health concepts should be specific towards the learning needs of the individual. Use multiple strategies in order to distinguish a method for the client: printed, telephone, audio, visual, computer-based presentations. Keep open communication with the client and the healthcare team, and continuously assess and document learning. The LEARNS model. That stands for listen, establish, adopt, reinforce, name, and strengthen. This model is based on an acronym that identifies the interaction of a client and nurse relationship. It addresses the importance of actively listening to the client to recognize their needs, so the healthcare provider is then able to truly have an understanding of the individual's perspective. This creates an environment where the individual is viewed holistically, allowing a therapeutic relationship built on respect, autonomy, and self-reflection to be formed. Purpose of guideline. This best practice guideline is to assist healthcare providers to become more confident, competent, and comfortable facilitating person and family-centered care. This guideline uses evidence-based practice in order to assess, intervene, and manage persons' care using a client-centered method. Best practice recommendations are provided in 3 areas. Number 1 is practice. Frontline interprofessional team who provide care to individual across all practice settings. 2 is education. Those who provide interprofessional and staff education. And number 3, system, organization, and policy. This can vary depending on the recommendation. It can include administration, managers, government bodies, policymakers, or regulatory bodies. As nursing students, the focus will be on practice recommendations. It is still beneficial to be aware of the educational and system, organization, and policy recommendations as well. What is a gap analysis? It's the difference between current knowledge and practices, so what we are currently doing, and current evidence-based practices, so what we should be doing. Gaps can occur in knowledge, skills, or practice. It is important when you look through this guideline to reflect on the following questions and be specific. Where is our current practice? Where do we wish we were / where should we be? Why has this gap occurred? And how are we going to close this gap? Performing a gap analysis on best practice guidelines is an essential part of reflecting on practice. When reviewing the recommendations, identify where there are gaps in current practice or knowledge and take the time to reflect. Steps to conduct a gap analysis. Step 1. Perform a needs assessment. Step 2. Determine the educational gaps in knowledge, skills, or practice. What is the best practice? Step 3. Determine purpose of the activity and program objectives and design. Step 4 is course development. Step 5, implement the activity. And step 6 is to evaluate the activity. Now we will begin to look at the recommendations for the best practice guideline, person and family-centered care. Objective number 1, assessment. 1.1. Establish a therapeutic relationship with the person using verbal and nonverbal communication strategies to build a genuine, trusting, and respectful partnership. 1.2. Build empowering relationships with the person to promote the person's proactive and meaningful engagement as an active partner in their healthcare. 1.3. Listen and seek insight into the whole person to gain an understanding of the meaning of health to the person and to learn their preferences for care. 1.4. Document information obtained on the meaning and experience of health to the person using their own words. These graphics look into verbal and nonverbal communication strategies. On the left, there is a list of verbal communication strategies, and on the left, you'll see a list of nonverbal communication strategies. This graphic is for your reference and looks at behaviors that encourage empowerment. This table provides a list of questions that healthcare providers should ask to determine the insight into the whole person, their experience of health, and their preferences and needs. Objective 2. Planning. 2.1. Develop a plan of care in partnership with the person that is meaningful to the person within the context of their life. 2.2. Engage with the person in a participatory model of decision making, respecting the person's right to choose the preferred interventions for their health by 1. Collaborating with the person to identify their priorities and goals for healthcare. 2. Sharing information to promote an understanding of available options for healthcare so the person can make an informed decision. And 3. Respecting the person as an expert on themselves and their life. This table gives examples of questions that healthcare providers should ask when seeking priorities and goals for care. This table gives examples of questions healthcare providers should ask when exploring knowledge about options and care needs. Objective 3. Implementation. 3.1. Personalize the delivery of care and services to ensure care is not driven from the perspective of the healthcare provider and organization by collaborating with the person on 1. The elements of care, 2. Roles and responsibilities in the delivery of care, and 3. Communication strategies. 3.2. Partner with the person to tailor strategies for self-management of care that are based on the person's characteristics and preferences for learning. This table outlines behaviors that improve effectiveness of care. Objective 4. Evaluation. 4.1. Obtain feedback from the person to determine the person's satisfaction with care and whether the care delivered was person and family centered. Listed below are the education and system, organization, and policy recommendations related to this best practice guideline for your reference. Objective 5. Education recommendations. 5.1. Educate healthcare providers at a minimum on the following attributes of person and family centered care to improve the person's clinical outcomes and satisfaction with care. 1. Empowerment. 2. Communication. And 3. Shared decision making. 5.2. Educational institutions incorporate this guideline into the curricula for nurses and, as appropriate, for other healthcare providers. This table outlines further research gaps and future limitations.